Health Nuts, episode 37.
You're listening to Health Nuts with Dr. Chris Carr. Making lifestyle changes is hard for many people, and not knowing what to do or how to do it makes the task all the more daunting. Here at Health Nuts, we focus on helping you live a fuller life by discussing everyday health issues and exploring breakthrough solutions on how to overcome them. And now, here's your host, Dr. Chris Carr.
Welcome back to another episode of Health Nuts. I'm your host, Dr. Chris Carr, and today I have on an awesome guest for you, and that is Dr. Jeff Williams. Dr. Williams is a graduate of Parker College of Chiropractic, which is down in Dallas, Texas. Dr. Williams is a chiropractic doc by trade with a private practice in Amarillo, Texas. He is an active member of the Texas Chiropractic Association and currently serves as chair of the Chiropractic Development Initiative. When Dr. Williams is not practicing, you can find him on TV as a guest on the local NBC affiliate, KAMR, every other Tuesday. He is also involved in pro bono work and is the host of the Chiropractic Forward podcast. He comes to us with over 20 years of practice experience and a ton of knowledge. His hobbies on the side are as an artist, a sculptor, furniture builder, musician, singer, songwriter. He is quite honestly the Swiss Army knife outside of his practice. Today is going to be an awesome episode for you because we're going to debunk a bunch of myths about chiropractic. And we're going to provide not only debunking the myths, but give you a lot of evidence to back that up as well. So without further ado, Dr. Jeff, welcome to the podcast. Awesome to have you on.
Hey, thanks for having me. That was quite an intro.
Yeah, it is a lot of work. You know, coming with 20 years of experience, you're no spring chicken in the chiropractic field.
No, I have the gray sideburns.
And I can tell you've been in private practice for a long time, as have I, because we got the receding hairlines to show for it.
Right there.
Yeah,
right there.
That is stress all day long. I hear you. Well, welcome. I'm looking forward to hearing your message. Your podcast has a lot of evidence-based research to it. We're going to be debunking various myths today. But before we get into the meat and potatoes of this, tell us a little bit more about yourself.
Well, you hit it pretty solid. I've been married to my high school sweetheart for 22 years. I've been together 26, longer than we've been apart. We've got 2 kids. I've got a sophomore in high school son and a 4th grader daughter, and just, daily practice. I'm in the grind. I'm not one of those, I don't want to say that. I'm a podcast host that is, I'm in the middle of it from day to day. It's my podcast is my side gig, and man, I love it. I'm absolutely loving it. I'm finding that it's a bit cathartic because I can get stuff off my chest that just irritates. I have a venue to vent.
Yeah. Well, I'm going to provide that forum for you today as well, because there will be some, maybe a little bit of venting about the misconceptions that are out there. And I'm going to look forward to clearing those up with that evidence you're going to support it with. So with that being said, I always like to start these off with an affirmation or a quote, maybe words of wisdom. What do you got to share?
Ooh, man, I already had that all down, but let me, you know what? I don't even have to look it up. My favorite one is probably Henry Ford, and I don't know if I get this exactly right, but he says, whether you think you can or can't, you're right. Mm-hmm. And for me, I've just always loved that because I love a good, solid state of mind. If you're positive, you're going to attract positive.
Mm-hmm. Love it. Yeah, kind of law of attraction always works.
Yeah. Have you ever seen The Secret?
I have read the book, seen the show. My staff. I completely agree with it.
Sure. Yeah. And, I tell people, hey, I don't necessarily think if I see myself or can fully picture myself in a Ferrari that I'm going to wind up in a Ferrari, but I do fully buy into the fact that if you wake up and step in your dog's mess on the floor and you let that run your whole day, negative is going to attract negative, and negative relationships, negative everything. But if you feel like that's true, then also the opposite must be true as well. So,
yeah, love it. And I completely agree with it. So I can't wait to get into this stuff because it's been burning on me as well. And
okay.
First topic with these debunking the myths, and I'm just going to go ahead and tee one up right on here. Chiropractic causes strokes.
Yep.
So back, I think the story took place a year ago, and why it hit so home from here is that there was a Playboy playmate that was injured. And this podcast, I'm from Pittsburgh. My practice is in Pittsburgh. Her parents live 20 minutes from here. So
really? I didn't know that.
Yeah, so born and raised in Pleasant Hills, which is the town she was in. So that time, that's about 6 or 9 months, because it made local news, and they were interviewing the parents, and it was like, oh, this just garbage was out there about, you go see a chiropractor, you're probably going to have a stroke within the next 24 hours.
Yeah.
So it was just a lot of bad press. But to debunk that myth, because I know how to debunk it, I've been in practice for a long, long time. But to the lay person out there, can you give me some evidence that actually proves that what we do is not going to make somebody sick? Okay.
Let's we can go through that case very specifically. I would reference people that, especially our podcast people. I did a series on it's called Debunking the Odd Myth That Chiropractors Cause Strokes. Mm-hmm. And it starts with episode 13 of my Chiropractic Forward podcast. So it's episodes 13, 14, and 15. And so to start it out, I kind of went through some other odds. Okay. So, that might be a good place to start right here. And so through the Rand Institute, it's estimated that a serious or adverse reaction like a stroke from a chiropractic adjustment alone happens approximately 1 out of 1 million visits. So let's put that into perspective. Okay. The odds of being struck and killed by lightning is 1 in 174,000 roughly. The odds of being told to come on down on The Price is Right is 1 in 36. Can you believe that?
Wow.
Yeah. The odds of being born with 11 fingers or toes is 1 in 500. The odds of dying from a firearms assault is 1 in 113. And I found this one fun and really interesting, was the odds of winning an Oscar is 1 in 11,500. Can you imagine that?
I might win.
It's time to move to Beverly.
Son of a gun, we might go to Hollywood.
Yeah, so when you compare those odds, the odds of winning an Oscar is 1 in 11,500. The odds of an adverse stroke type event from a chiropractic adjustment alone is 1 in 1. Okay. I mean, so, the message is there's absolutely basically zero risk of that. Now, Katie May in particular, Katie May, queen of Snapchat, right, all that good stuff. I'm trying to go through my show notes real quick to find that so I can reference it very specifically for you. And
yes, I think for the local crowd, this will hit home just because of how prevalent that news story was in our cycle.
It was prevalent everywhere, much less there. I have a video that I recorded back then that really kind of dives into this. But if you remember, the very initial reports were that she had a bad fall on the set of a photo shoot,
right, and
she hurt her neck. And then the report said that she went to the ER. Now that the family is suing the chiropractor, they're saying, no, she didn't go to the ER. Who knows? There's some confusion there. So she posted this message, quote, pinched a nerve in my neck on a photo shoot, got adjusted this morning. It really hurts. And she was asking for home remedies, basically. So some of the things that can cause a vertebral artery dissection, like she suffered, it can happen spontaneously from an underlying connective tissue disorder. Strangulation, we know that didn't happen to her. But here's the biggest thing: physical trauma, a direct blow to the neck, a car wreck, something of that sort. So and I cited this paper by Debunking et al. Quote, trauma has been reported to have occurred within a month of dissection. A month. In 40%, with nearly 90% of this time, the trauma being minor. And so when you think about it, she goes in, I mean, it could have been a month after this fall. But to just lay this on the chiropractor is absolutely incorrect. Now, he probably didn't help it. If she went to the ER, they missed it. He may have missed something, but almost all of these people show up with headache and neck pain. Well, I mean, how many of those patients do we see every day? Every single day. And are we going to get a CT angiogram or an MRI on every single one of those patients? No, of course not.
Yeah, nor is the ER doing that either. You can be in a very severe accident, and they're just going to give you 800 milligram Motrin and send you on your way. They're not even x-raying a lot of patients that are in whiplash injury.
Absolutely. And so the LA coroner comes out later on, like a year later, and he lays it all on top of the chiropractor. He says, chiropractor. Yeah. So, I went and did a little bit of research on this coroner, and I'm unaware of his level of training or expertise, but his office has been under scrutiny for being understaffed, underfunded. And, I would say just because a man or a woman is a county coroner does not mean they're above some of the old dogmatic beliefs that they were taught in, or not really taught, but, that they heard from their mentors or whatever going through medical school or going through residency or what have you. They're not above that stuff. But I promise you, that coroner has zero knowledge of the body of literature on this sort of a deal. I mean, to lay that fully on that chiropractor is absolute ignorance.
Yeah, and we have the outside the research, we've got the malpractice insurance premiums to back that claim up as well.
Sure.
We would have, and I don't know what you're paying, but I'm going to assume it's probably closer to where I'm at. I think I pay about $1,800, $2,000 a year.
So, yeah, something like that.
Yeah, and I have multiple surgeons in my family. They can pay anywhere from 30 to 40 to 50. My uncle's a retired anesthesiologist, was the same. OBGYNs are, I think they're in like 60s or 70s.
Absolutely. It's unreal. And I tell people, the reason that our malpractice is where it's at, and, this isn't research that we can stand on, but it is, trust me, insurance companies, they know their risk. They know it almost to the cent. And if there were risk in going to a chiropractor, that would be reflected. There's risk for getting heart surgery. That's reflected in their malpractice. There's risk for, going to an invasive radiologist or, somebody that does the invasive procedures. And their malpractice reflects that. And our malpractice reflects the fact that there is little to zero risk of going to the chiropractor.
Yeah, if they're paying out these claims, I mean, God forbid, if somebody loses their life in an office, it's going to be it's going to be a 6-7 figure settlement. If that was happening all the time, we would be just 10, 15, 20 times past what we're paying. But it's just not the case. So outside that myth, because we had to research those journal articles, which I'll do in the show notes to the audience, they'll be there. I'll put the journal links in there so you can double check to make sure if you're not buying what we're selling. But we are two honest characters here. So you don't want to take our word for it. You can click on the show note and you can go to the world of Google and we'll give you that research article as well.
Well, here's the best thing about research is if somebody listening doesn't like chiropractors, I don't care. You can argue with me all day, but it doesn't matter to me because I'm not the one that did this research. I get to stand on the shoulders of insurance companies, medical research, physical therapists that did the research, hospitals, insurance companies, governments. Go argue with them because that's what we're talking about. We're not talking about chiropractic stuff.
No. So the other, another big myth that comes to mind as well. So there's a couple of them, obviously. So maybe another one would be a pain-related myth where it is maybe not the best pain alternative for a patient to go to. They might send somebody to maybe a physical therapy or actually have them take over-the-counter meds. Maybe another myth we can run with would be once you go, you've always got to go to see a doc.
Yeah, boy. Don't we all hear that one all the time? I think that the way that I approach that is, you know what? I think that treatment and research thinks that treatment should have a start and it should have an end, plain and simple. And that should be reflected in how long it's been going on and how serious it is. If somebody just woke up with a stiff neck yesterday, obviously they don't need 40 visits this year to address that. On the other end of that, if somebody's in a serious car wreck, well, now that would be a different deal, right? But it should have a start, it should have an end, and it shouldn't be ongoing forever. But at the end, we hope that people got so much relief and it changed them to a point where they want to come and see you once a month, once every couple of months, whatever makes sense to that doctor and that patient. I hope they come forever, but it'd be their choice.
Right. And at that point, now you can walk down the maintenance path and go into the benefits of the research that's out there for patients, the studies that have been out there for patients been under maintenance care compared to the pilot population that wasn't under care. The amount of pharmaceutical drugs that they decrease in taking, the decreased amount of hospital visits, surgeries,
right.
The data is pretty hardcore. And it's not just a 5 or 10% difference. It's like 50 or 60%.
Yeah, and I went through I don't know what episode it was. We're only 23 episodes in on the Chiropractic Forward podcast so far, so it wouldn't be hard to find. But I just went over one. Here it is. It's episode 19, and it's called Non-Opioid is More Effective While Chiropractic Maintenance May Be the Most Effective. So there's some great research that shows that ongoing maintenance chiropractic is it's absolutely effective at keeping the doctor away.
And one thing that I looked into, what I liked that you were doing, why I was attracted to some of the stuff you were saying, the pro bono work you do. I do pro bono work up here as well. We have the first of its kind drug-free pain management clinic for opioid addiction and for veterans as well. And we have this initiative that started. What does chiropractic have to do with that whole epidemic and the opioid issue that's out there? Where do we fit in?
Oh, man. I don't even know where you start on that one, right? For veterans specifically, okay, they are at double the risk of being prescribed an opiate to start with. On top of that, they are at double the risk of the general population for dying of an overdose. And these guys, I don't know about your practice, but the veterans that we see come in here are among the worst cases that we see. I mean, these guys, in many cases, I've got 2 patients that fell out of helicopters, right? I've never even been in a helicopter. So, obviously your active military and your veterans are going to be in worse shape than, your insurance salesman down the street. And they're usually going through some sort of post-traumatic deal, and they're just at higher risk. And there is no doubt when it comes to the research that we are in the unique position to help them better than anybody else. I have been going over research. It's hard to just keep on banging at low back pain. Mm-hmm. But when new research comes out to just keep on adding and piling on, I mean, what are you supposed to do? You just keep on piling on. And so there's research that shows that exercise rehab alone is not as effective as exercise rehab with spinal manipulation.
Right.
And chiropractors perform 90% of spinal manipulation in America. So that's a clear way of saying that exercise rehab combined with chiropractic care is more effective than anything else out there. There's also research that the ACA blog posted of mine that I wrote, showing that chiropractic is more effective than diclofenac which is a common medication that they give for musculoskeletal pain. So when it comes to medication, chiropractic's more powerful. Research shows it. When it comes to physical therapy, and I love physical therapists, so I don't want them to get mad at me, but when you combine it with chiropractic care, it's more powerful. And so when we're looking at opioids, we're looking at low back pain as the number one cause of disability around the world. We're trying to figure out non-pharmacological ways of treating these people. We are in the perfect storm for chiropractic. It's never been like this before. You've never seen chiropractic research being held up and supported in the Journal of the American Medical Association. I've seen 2 articles in the past year. We've never seen the American College of Physicians come out and say, for acute and chronic low back pain, our new recommendations are chiropractic. They call it spinal manipulation, but I call chiropractic because that's what it is. Acupuncture, massage, and exercise rehab. We've never seen this stuff.
No, and one, because we get into the whole case where they tried to get rid of us because they've been trying to fight this uphill battle that they've lost through the years.
A lot of people don't know that history.
Yeah, where they they tried to get rid of us, and they were damn near successful doing it.
Well, their stated goal was to wipe chiropractic off of the face of the planet.
Yeah. And that was written down, and that was, we used to, it's crazy to think back in the day that for doing what we do, people went to jail for it.
They went to jail for it, but even beyond that time period, and I've got this right in front of me, so I'll run through it real quick. But if you guys out there have not heard of Wilk versus AMA, that's WILK, Wilk versus AMA. I've even talked to the attorney that won this for us.
Oh, wow.
An amazing guy. But this started in the 70s, and basically we were able to prove that the American Medical Association, in conjunction with the American College of Physicians and all these big entities in the medical field, we proved that they were guilty of encouraging ethical complaints against doctors of chiropractic. Can you imagine? They were telling people to file complaints against us, which is just so wrong on so many levels. They opposed chiropractic inroads into health insurance. And I say, geez, if you didn't like us, you should encourage us having to deal with health insurance because it's a nightmare.
Yeah. Welcome to the party, and you get to deal with insurance companies.
They opposed chiropractic inroads into workman's comp, opposed chiropractic inroads into hospitals. They attempted to contain chiropractic schools. They conducted nationwide conferences on anti-chiropractic behavior. They distributed publications critical of chiropractic and put those all the way down through the state level to the doctor out in the field. Here's this one just really gets me. They warned that professional association between medical physicians and chiropractors was unethical, and they would not allow medical doctors to refer to chiropractors, which, yeah, I get it. But here's the big one. They wouldn't allow They wouldn't allow medical doctors to accept referrals from a chiropractor.
Couldn't see them.
That's the one that gets me. And this was going on until the late 80s and mid 90s when we finally won that in the Supreme Court.
It was somewhat recent, a number of years ago, but nonetheless, it wasn't too far out. I'm not talking about the Civil War time frame here.
No, it's crazy stuff.
So before I let you go, I'm gonna just do some rapid fire questions with you.
Oh, let me find those real quick. Let me find them. Is this the WOW round?
The WOW round. You're in it, buddy.
Oh, I like it.
I love it. Best advice you ever got?
It was from a mentor. I recommend everybody get a mentor if you've never had one. He told me, start being confident on what you do, value your time, and value your service.
Confidence is key.
Absolutely.
What makes you a health nut?
20 years in the healthcare field. Honestly, you see just about everything. You also see people not following your recommendations and what happens when they don't.
On your nightstand in your bedroom, what's the book on there?
Whew, the book. I like Made to Stick by Chip and Dan Heath. I love marketing. That's the one I'm reading currently. Probably one of my favorite when it comes to marketing is called Influence by Robert Cialdini. It's a very well-known book.
Now we got this audience is a lot of times, unfortunately, there's a lot of them aren't in the best of shape, and they are, they're sick, for lack of a better word, and some are on multiple medications, some are pre-post-op, and they're out there, they're struggling, looking for answers. Someone who's out there who is kind of sick and tired of being sick and tired, what do you tell them?
I say, understand there's no constants. You are the chief of your train, and it goes wherever you choose for it to go. Let's take the new recommendations for low back pain. Don't lay in bed. Get up, move around. Your mind is as important as your body, and being right in your mind usually leads your body to follow along. And if you've got a good positive mental attitude, whether it's with pain or whether it's with weight or whatever it's with, and you are consistently doing the right things with food, with setting a timer so that you don't forget to do those push-ups at night before bed or whatever. But if you're consistently taking the right steps, then with your mind, your body will go in the right direction.
Lastly, someone who's trying to find you, what's the best way to get hold of you?
Chiropracticforward.com. We're on iTunes, Stitcher, Libsyn, all those podcast things. I'm still new at, so I don't know them all off the top of my head, but you can certainly find me at chiropracticforward.com. We've got Twitter, Chiro_forward. We've got a Facebook page, Chiropractic Forward Facebook page as well.
To the audience out there, the show notes will have all of those, all the social settings will be in there, as well as to the podcast.
Absolutely. And
to one podcast, get one podcaster to another, keep on keeping on. We need the message out there.
Man, I appreciate you. Thanks for having me on.
Appreciate you, Dr. Jeff. And to the audience, look forward to talking to you soon. Have a great week. Bye now.
So, you've heard from the experts yourself this episode and have gotten some golden nuggets on health. There is so much more to come and so much more to learn. Head on over to pghcw.com. Again, that's pghcw.com, and sign up for our newsletter where you'll receive free info on how to get and stay healthy. Thanks for listening, and we'll see you next time on Health Nuts with Dr. Chris Carr. Be sure to subscribe to the podcast and please leave a review.